pharmacist with the Thrive team. I like to sit down with all of the patients that come into Thrive, and I get some background information first, like allergies, social history, things like that. My primary goal is that when they walk out of that room, their medication list in the medical record is exactly representative of what they're doing every day. So we talk about what they're doing sometimes, what they're doing all the time, how they're maintaining their medications, how they're organizing their medications. And of course, I'm looking to see if there's anything glaring or like that I have questions about, scratching my head about, I can't really rationalize. So I rely a lot on the patients to kind of help me fill in those pieces. And sometimes we just can't in that visit. So it's a matter of kind of going back and doing some research and doing some digging and trying to connect the dots and figure out what's going on here. They'll walk away from the evaluation with a list of things to consider that might improve their overall health. That is obviously the goal. I joke that even though I'm a pharmacist, I'm far more often stopping things than starting things. It's my hope that everybody walks away from that visit not only with a better understanding of what their medications are doing for them and what role they're playing, but also of pharmacists and the ability that we have to kind of be an accessible point of healthcare for people and can often maybe help people avoid visits that aren't really necessary with some of the medication things that or questions that they have. I think my hope is that when people walk away, they just have a greater understanding of I hope that's the impact that we're having as pharmacists for the Thrive program. I hope that they just know more and are more comfortable with the things that they're taking. A lot of people come to us and they want less medication. They want less sort of chemical intervention, if you will, and that actually has different meaning from one person to the next. So I try to figure out, what is your goal here? What's working well, what's not working well? What would you like to see go differently for you? And I will try to help you get on that path and provide some recommendations for that moving forward. Even today, there was a patient that I saw that, we talked about some of the things that they were taking, and we tried to trace back the roots of that specific medication, if you will, to try to figure out why it was there to begin with and if it was still necessary. And in multiple cases, often we find it's really not anymore. And then I kind of work out a plan for if it's something I feel comfortable recommending that they stop. Absolutely, we create a plan there. If it's something that I feel like they need to take back to their care team to discuss with them, then I'll make a plan for that too, and just say, ideas for consideration. This might not be what's best for you, but if we were going to do it like in this clinic and with me following up, this is how I'd like for things to kind of roll out. So they can have some tools and things to look back on, but in general, just stopping things tends to go over well when you can do that.